Come in.
Hi, Mrs. Jones. My name is Amy, and I'm going to be your occupational therapist this evening. How are you feeling today?
I feel okay.
Okay. Your doctor has ordered an OT evaluation, which will include me addressing some of the symptoms that are preventing you from doing the things that you would typically do in a day. So it is to my understanding that you had a stroke affecting your left side preceding your cardiac surgery. Is that correct?
Yep.
Okay. Are you aware of your precautions?
I forget them actually.
Okay, well let's go ahead and review those. So you have some sternal precautions, which consists of no lifting your arms above your head or bringing them behind your back. So no getting anything out of your back pockets. No pushing or pulling, so pushing to get out of bed or opening a door. Lifting anything that weighs over 5 pounds. You also have a nectar consistency liquid diet due to swallowing difficulties. And you tend to have a drop in your blood pressure whenever you are standing. Is that correct?
Mm-hmm.
Okay. I see here in your chart that you live with your spouse. Does your spouse assist you and help out with things around the house, or are you pretty independent?
I do most things myself, but my husband helps a little bit.
Okay, great. So I see here that you also live on the first floor of your condo. Is that correct?
Mm-hmm.
Okay. So there are no steps leading up to your complex or a curb. It's pretty flat ground.
Yeah,
Okay.
all flat.
Great. So now what I'm going to do is I'm going to kind of just run through a little OT eval and kind of ask you a few questions, might get you moving a little bit. Is that okay?
Yep.
Okay, if you start to feel any pain or uncomfortable, just let me know. So speaking of pain, what is your pain level today, just on a scale from 0 to 10?
It's about a 6 right now.
A 6? Okay. Okay, can you tell me what day it is today?
Today is December 13th, 2015.
Okay, great. And why were you admitted to the hospital?
I got heart surgery.
Okay. And what did you have for breakfast today?
I had coffee and eggs.
And how was that?
They were fine.
It was fine? Okay. What year were you born?
I was born in 1962.
Okay. Do you have any vision problems? No?
No.
Okay, can you tell me the time of the clock that's behind me?
9:33 a.m.
Okay, perfect. So how do you care for your pet? I see here that you have a dog.
My husband and I take him for walks every night, and whoever is home usually feeds him.
Okay, that's great. Okay, so now what I'm going to do is I'm going to have you sit up, if that's okay with you. I'm going to go ahead and help you, making sure that you're not pushing down with your arms to get up. So I'm going to go ahead and help you up, and then I'm going to perform a little muscle test to kind of see where you stand as far as strength goes, okay?
Mm-hmm.
All right. So on the count of 3, can you go ahead and sit up for me? 1, 2, 3. Okay, how do you feel?
I feel fine.
Okay, so you're okay like that?
Mm-hmm.
Okay, can you do me a favor and just put your arms out like this for me? Okay, great. You can put your arm down. Can you do a bicep curl for me? Okay, great. And can you squeeze my fingers? Okay, good job. Can you show me how you would brush your teeth?
Mm-hmm.
Okay, great. And show me how you would wash your face. All right, great. That was just kind of me checking on some functional range of motion. Okay, let's go ahead and sit back down so that we can just kind of chat about a few things. All right, perfect. So first let's talk about some goals that we can kind of achieve throughout your time here. So since your strength is low on the left arm, I think that that's something that we need to focus on while you're here. Just kind of building your strength, getting you to a higher independence. And I also think that it would be beneficial to work on dressing activities. Getting a shirt on over your head might be kind of difficult since you can't lift your arms up. So we'll go ahead and teach you some ways to do that. And I also think that performing some positional things with you, like, sit to stand, or, just laying down to sitting up, that kind of stuff, since you have a drop in blood pressure, I think that that would kind of be beneficial as well. Let's see. There are some things that you can do that would benefit you whenever a caregiver, therapist, or a doctor is not in the room. I can get you some putty and just kind of have you squeeze that, which would just help with grip strength. Would you be interested in that?
Yeah.
Okay. Also, I know that you are having some trouble with your bowel movements. I will inform the nurse to kind of make sure that you're being mobile throughout your stay here, because that tends to help with bowel movements. Also, as far as your plans after you leave here, where are you planning on going?
I'm gonna plan to go home. If I
Okay.
can.
Okay. So I can check into ordering you a rolling walker for whenever you go home, just to kind of help with balance until you regain your full strength. And also I can check into ordering you an incline supporter, so just to kind of help you stay at that 45-degree angle. Would you be interested in that?
Yeah, that would help.
Okay. Also, I think it would be a really great idea to refer you to speech therapy to help with swallowing. And also, I think after you're discharged from here, I think it would really benefit you to go ahead and be referred to an outpatient clinic. We have a ton of outpatient clinics that we can refer you to, depending on where you live and that kind of thing. And I think that that would really help with your strength and help you get back to an independent lifestyle. Is that something that you would be interested in?
Mm-hmm.
Okay, great. Well, I will go ahead and look into all of that for you. And as far as your next visit, you'll have OT every day until you're discharged from the hospital. Okay?
Sounds good.
Okay, well, if you need anything, you let your nurse know, and I will see you tomorrow.
Great, thank you.
All right, thank you.